we can jump, don't save. Okay. And I also make a setting into the printer setup. We go to print section here. You can use here A4 size letter code, or you are going to use the printing setup accessory, and margin we should use background option is enabled, and header footer you can check. So this is a small setting done. Now please log in into the software with your ID password. Capital. Okay, let me try. Correct? User name. Okay. Now please go to registration and create a patient OPD. You can block the camera if you don't want to use. Please select the doctor after that. Okay, please okay. Scroll down. So you can see the OPD fees automatically will come, the amount which we have want to use here. So okay, amount is not coming. Please let me check in master. Can you go to master? Now click on save and print. If you want to take a printout, yes, it can work. But it will, if you save print, it will give a printable confirmation. Here, please mention here, not here. This is ID proof number. Here. Yeah. And just click on save and print. Let me check it. I think validation is missing. Check. What is missing? Amount call. Okay, the amount is not coming here. Let me check. Master amount is validation. Yes, now it is coming OPD fee services. Okay, now please test it. Hmm. Mobile number. Now click on save and print. Oh, the panel selection is yes. Okay, so the one patient receipt come and one OPD prescription is printed. If you don't want to print, skip by editing, so it will disable. Okay. Yes. Now, if you want to maintain a patient's vitals record, you can go to the token display window and you can write the vitals of patients. Yes. Here you will get the patient entry which we done. E-prescription. Yes, yes, yes. No, it also go to the doctor prescription. If you go to e-prescription menu, the patient list will be there and you can write him prescription. Okay, you can select the patient, right? Yeah, these are the actually the entry was printing not coming because zero receipt amount. So we will enable zero receipt also printed. Okay. We when we click multiple times save and print, it was saving, but we could not see the printout. You was clicked on save button, right? So the system was saved, but the printout was not coming confirmation. That's why we suggest you, whenever you are making any patient entry, click on save and print. So a printout will come that will make you sure that the entry has been successfully saved. Yeah, you click on number 5 here. So all 5 patient list will be shown like this way. Okay. After you can put the vitals record of any patient, like you click on add vitals here, and the vital record BP, pulse, respiratory you can mention here in the respective patient. Okay. After, for example, let me mention here some value. 60 will like here 60 pulse rate, SpO2 76, respiratory for 16 by minute. Here we can maintain grade patient, height, BMI. Here what is the complaint like patient, fever and chest pain from last to 5 days. Even here we can mention patient temperature in Fahrenheit and we can save the prescription for patient. After, when patient be sent to the doctor cabin, the nurse can click on accept button, and this patient reflect in corresponding doctor's account. Okay, this and now the doctor want to writing any prescription, so he can select the patient here like this, and he may be see the what vitals have been mentioned by nurse or ward boy, and they can prescribe patient services. And if we want to select multiple diagnosis selection, so we can select disease or complaint of the patient during the conversation along with multiple diagnosis can be also add in the certain patient. Okay, so these are disease which are linked with the ICD database, and here complaint like the pain in chest, okay, side like right side, okay, body part in chest like that, and pain 2 or 3 times a day like this way, and duration last 15 days like this one complaint. Here patient came with complaint of fever and yeah. Yes, there is one feature working. If you are writing some information in software, so what is doing system, there is the auto storing function. So if you write any other patient this similar product services, it will auto suggest you. I will guide you in the next one more patient, so you will easily understand. Okay, patient advised to take rest. This was the some clinical suggestion. Now if you like to advise hospital services, for example dressing, so it is giving you suggestion from master data. Okay, like stitching. Okay, so this way. If you like to advise investigation like CBC test, so it's give you suggestion which is available data master from our already software. Okay, like lipid profile. Okay, and here the radiology services, x-ray or USG test, sonography, MRI, CT scan. Okay, so you can use this respective item masters. And here if you like to advise medicines part to the patient, that the pharmacy item is not there, I will make you a presentation how pharmacy data will come here, everything. Okay, for you if you want to advise like here Calpol 500 mg and for 5 days, and TD and 5 tea thrice in the day, and total medicine here how to take like after meals, and like zinc COVID 250 mg 3 days or 4 days of BDS, and before meal. So I just write this prescription for one patient, and we also advising revisit in OP after 5 days with your previous medical report. Okay, like that I write some one demo prescription first time. Okay, and I select if I save this prescription, okay, this will be saved for one patient. Okay, now if any other patient will come in the same doctor account, so let me check if any patient is there in the same account doctor. Okay, so this is your another patient. Okay, if I type something in the clinical suggestion, you can check that this is auto suggesting what you want to use if already typed content, so it will help you to reduce your time during typing the every content if its system previously used. Okay, similarly the complaint side, if you have advice like pain in complaint, so it will give you master suggestion if you advise. So some data coming from master, some data is coming from doctor used writing pattern. Okay, yeah. Here the medicines or something, this is comes from master because the medicine is linked from pharmacy store. Now the request to prescription which we have saved with the respective item services of medicine or something, so this request will reflect at the billing desk that what item, like this is the services, investigation, radiology services to be performed, and this medicine request have been prescribed by doctor. So this is a e-prescription for the patient. It can be redesigned according to the letterpad of the respective hospital and QR code scannable. Okay, I think you have some important call. Shall I continue? Okay. After that, if this patient will go to billing desk to make the payment of services which prescribed by doctor, so we go to OP billing. The patients will come here with the notification of bell icon. You can see this one patient 8 bell icon is coming with the request of this patient we have to perform billing, and there is no any other patients have any notification demand task like this. So we select the patient, and this patient will able to see his billing. The billing user will see this patients have this kind of the requested by CBC test, lipid profile, RFT, radiology services, X-ray, and the user will select mode of payment, like how the patient making payment, mobile payment, NEFT, cash or debit credit card, and this way he can save the billing of patient. Okay. Now if we save and print, at this event system will give a payment receipt of item services for laboratory services and radiology services. Okay, so here it is perfectly working. Now any doubt or you want to know, or shall we proceed for further? Okay. So it was billing. Yes. For that you need to create every department specialist doctor, like one for general medicine, one for orthopedician, one for ENT, one for diabetologist. So the system will pull the respective prescription and connectivity in the master. Okay. So if you want to do so, we may go to master window, and here we can make patient doctor, like here if I go doctor window, let's create one patient, for example dentistry or diabetic. Okay, and I put here doctor. Okay, you can create a different doctors, and here you can put so like this way you need to create a doctor profile. Okay, so I creating doctor's name, department and something, and I mention only red entries, rest detail I have bypass. If I want to maintain here like diabetes department, and this is the doctor's joining date, like 01/01/2024, the date of joining, and what is his salary, like 45,000. If any PF or salary account, like PF 001. This is his employment number or something which we use in India. I think there may be also some government identity number. And here the salary bifurcation. Okay, like 25,000 is the basic salary of employee, and house rent allowance like 5,000, conveyance fees 2,500, Okay, like this way the configuration will do, and create like from there. So we can make a bifurcation of the service which we giving to employee. Okay, 200 like this. So the 45,000 bifurcation we have put here everything. And if the doctor good perform business, so we can make a incentive slab also, like consultation services we give him 10-20%. if we prescribe laboratory test to the patient, so we put here 30% incentive for the investigation prescribing. X-ray services we put here in amount I think $50 or Iraqi amount for every service to the prescribed patient, and here 25%. Yes, exactly. So this is commission setting of the respective doctor. Okay, so we do 17. So this is a doctor master profile we have created. Okay, and if we see this respective doctor list here, you can see this two doctors making doctor fees yes and this yes, but this is no. It means you have created doctor, but it's a respective consultation fees we did not define. So we want to define, so we click on no button, it will redirect to the consultation service window, and here you can put the consultation, like this doctor fees is like $250 or respective currency. Okay, I put here consultation service like 500 for international patient, like that, and here we can put okay, and the consultation we have defined in master. Okay, now if you go for registration, we will get the respective doctor here, and we can create a OPD service set, and this patient will come in diabetes module only. So here we have diabetes doctor here, and the consultation fees is coming. We can create a one patient also in that room. Okay, I put here patient address like okay, and patient ID proof number, and the consultation is also coming automatically. And just we click if we want to give any discount like 10% discount, so we can put here like staff. The remark will be required during the discount option. Here if we have payment option like debit credit card, sorry, the Zoom meeting was over. We shall continue on the WhatsApp call if you don't mind.
Yeah,
Okay.
that's fine. We can go. So you have still
One second.
control of my screen?
You getting my voice, friend? Hello. Okay.
Hello.
Hello.
Sir, good evening. Yes, sir.
Yeah, I am here with you. Do you getting me? So here you can mention patient mobile number at panel and click on save and pay. The diabetes patient entry will be system save for you. Ten digit. Yeah. Okay. So in front of the initial you can put 0. I will make it for 9 digit. No problem. Okay. You can, you do here right tick, after click on OK, it will not ask again. Okay, so it is no record found. You put here 0 in front of mobile number. Okay, now here why it is coming no record means the mobile number which you are using, that is not available in the software. This may a pre-reminder to make a duplicacy of patient. Okay, hmm. Hmm. Yes, it will show the record is already there. You can use the same record also. I need to enable from master. I will make it from backend, enable the duplicate mobile number checking option. Okay. So please use any mobile number and check that tab. Yes, to use the tab button, tab to, yes, if you put the mobile number, you can see the mobile number's previous record have been reflected on the top of the page. You see that, and you can select from existing mobile number. Still, if you want to use any new patient, so it will allow that the mobile number you want to create a new patient. Sometime you know that we are a family, so the same mobile number we can give for our child, our parents, our brother or relative, like that. So the same mobile can be used on multiple patient ID. Okay, now if you click on save and print, the OPD services will be come here, printable record. Click on save and print to get the confirmation. Yes. What button you have used, pressed? But I think we was making registration. So have you saved that patient? I think we could not save. Let me do that. Let me help you how we should complete the OPD. Please go to registration. The patient is not be saved yet. Go to registration and make a diabetes patient selection and fill the record, and after click on save and print. Patient address, and after that click on save and print. Patient address is missing. Have you saved it? I think my screen is coming little bit delay due to the internet connection. I am not getting response. Have you saved the record, sir? Okay. Good. If you check this patient, in the token screen will also show, the same patient also will show in the diabetes module also. It is coming there, patient now. Good. Yeah, you. Hmm. Yeah. Okay. So please go to master module. I will guide you. You can do a one more entry, for example. Let's go to master. Okay. After go to number 5. Sorry, 4 number. Doctor or staff creation, right? And you fill the one doctor like gynec or orthopedic department. Oh, yeah. So click on orthopedic and mention a doctor's record for the orthopedic doctor. With the mail ID, phone number, and everything should be mentioned. And after you can come down at the page and save the record. So in your country, the mobile number will be only 9 digit, right? Instead of 10 digit. Yes. Only few master setting if you do very well, the software will help you to very well working how the system is working for you, right? I will make you guide that. You can save at the come down, scroll down the page, and the bottom of page you will have option to save the record. Okay, only red color field is mandatory. Rest you can bypass. Okay, yes, submit. The record will be saved in the software. Now if you can check on active specialist, so in that the doctor's name will show, and you can create his consultation services also to make it OPD services. Yes. For that you need to first create in the doctor's consultation fees. So system will charge for the patient for another visit of different doctor. So until does not make consultation facility in master, the registration or visit will not able to applicable on that patient. Reconnect. I think their system has been fluctuated. I sending request on any desk. Can you accept this? Do they accept my request? Yes. Mm-hmm. Let me check it. Let me check it. I'm not able to see proper screen. I think due to internet is. Okay. Okay. So the consultation share percentage you did not mention. Please come back to previous screen. Okay. And here, if you don't want to mention any percentage, you put here 0. Okay. So it will give 0. Sorry, time gap is mean the how much time take for one OPD, and here you mention OPD 004 for example. Okay, and after you submit the record, one second, the doctor's name which you selected. Okay, okay. So it will share the record for you. Doctor fees updated successfully. Okay. Hmm. Hmm. Yes. Yes, you can go to registration or take an appointment facility appointment window. This will allow you to create OPD services of the doctor. Kuldeep. अरे डॉक्टर फीस के अंदर अगर अपन को परसेंटेज ये नहीं डालते ना, एरर फाड़ता है वो। जैसे आइटम का नाम कंसल्टेशन डाल दिया, अब अगली सर्विस में 0 0 नहीं डाल दो, डिफॉल्ट 0 नहीं आने से एरर फेंकता है वो। सही करो उसको मास्टर में। एक मिनट सर, ये कौन सा? हाँ, उसको सुनील जी को बोलो करे सर्च मास्टर पे। या सॉरी माय फ्रेंड, यू वाज रिक्वेस्टेड समथिंग मी। You have created patient appointment. Okay, okay. For example, yes, I can see your screen. So I will go to the like OPD patient, for example. Okay. So I will check all my patient list that will be available here. And if I want to make schedule for appointment for any doctor, like this is the patient Nasruddin. Okay. So if I want to make this patient's appointment, okay. So I will use this patient's record. I go to appointment section. Okay, and if I go here patient name, and I will find out the patient entry. If the patient is there, I will patient name and just click on search. This patient's record is coming here, right? And if I select the patient, this after clicking the, you can see the patient's the basic detail have been reflected in the certain field with the name, mobile number, his age detail here. And now on, for example, you want to give the orthopedic doctor's appointment, so select the orthopedic doctor and which date you want to give appointment. For example, tomorrow's appointment you want to give, and after selecting the doctor's, it will allow you token the one number, because time schedule is not coming. We did not define the time slot in master, but the token number 1 is giving by software as the first token for this patient. Okay, and just to be save and print, the appointment entry will be saved for this particular patient for orthopedic doctor. Okay, like this way. Hmm. Hmm. Yes, yes. No, no, not yet. Not. It is the appointment. We did not make patient registration. Until you did not make any patient registration, it will not come in the respective doctor, because appointment is a future perspective. Once the patient come to the hospital, we need to make a registration. After the patient will land in the respective module. So now go to appointment module. How to complete his visit? So I will guide you that. Please go to the appointment menu from the system. One second, let me guide you. This is the appointment section. Not there. Please go to appointment menu. Okay, here, and you can go to appointment record to access all patients' appointment history which you have created. Go to here, and as of now today's there is no any appointment, but you want to see future or all available appointments, so you can show all. So all futuristic appointments record will be there. Okay, one second, the date is not coming. One second, from today and tomorrow, and search record. Okay, what is happening? I think due to doctor validation. Let me check, some validation is maybe blocking, so I will check the appointment doctor validation or something, and I will reply you. Okay, appointment record. Okay, so if you want to get this patient into the orthopedic department, so you can directly create a registration. Okay, so any registration for every doctor you create, the patient will reflect in respective module like orthopedic, ENT, pediatric, diabetic. So that patient will automatically comes once you create any entry from this page, from registration page. Sorry, I didn't understand. Repeat, please. Okay. Yes. For to do so, to make any patient edit record, you may go to the any billing module or e-prescription module, and here you will have patient's action button. Okay, these are the action button, and if you click on the action button, system will allow you make patient demographic detail editable, like patient name, age, mobile number, its address, or anything you can change in the respective patient record. Okay. Thank you. Perfectly fine. Okay, if anything's come, you can message with screenshot, so I will help you in that, what is the challenges or what should you should do to prevent this kind of the challenge, to bypass, and system smoothly will work for you. Okay, thank you, good day, bye.
ये प्रॉब्लम आई थी अभी नहीं
कोई छोटी मोटी